good morning and good evening once again, classmates and mom all over the world. The case study that we have prepared is all about congestive heart failure. We are the group 6, the Bulacan Piat Canada group. Our group consists of me, Devon Ray S. Youngson, to present to you the introduction of the case study, Cristina Maria Alvarez to present to us the objectives of the case study, Rochelle Alvarez to present the nursing management, Joanna Marie Osario to present to us the case report, Christian Marie Bulusan to present to us the nursing care plans, and Sir Jonel Miranda to present to us the ethical consideration, discussion, and conclusion of the study. Next slide, ma'am. So the abstract of our study. This case study explores the clinical presentation, diagnosis,
Um,
and management of congestive
Sorry,
heart failure in a
hello,
cooperative.
Sir Devon. You can skip
Yes,
the abstract. You can start with introduction na lang.
okay, ma'am.
Thank you.
Sorry. What is congestive heart failure? Congestive heart failure is a complex clinical syndrome characterized by inefficient myocardial performance, resulting in compromised blood supply to the body. It results from any disorder that impairs ventricular filling or ejection of blood to the systemic circulation. Ischemic heart disease is the leading cause of death worldwide and also leading cause of congestive heart failure. Congestive heart failure is a common disorder worldwide with a high morbidity and mortality rate. This case study seeks to clarify the progression, prognosis, and treatment of congestive heart failure by presenting the clinical journey of 50-year-old. I'm sorry, I lost the connection. This case study seeks to clarify the progression, diagnosis, and treatment of congestive heart failure by presenting the clinical journey of a 50-year-old male patient with a background of hypertension. Through an analysis of the patient's symptoms, diagnostic evaluation, and therapeutic measures, this case offers valuable perspectives on the comprehensive strategies necessary for the successful management of congestive heart failure. The pathophysiology of congestive heart failures involves decline in cardiac function, which can stem on various underlying factors such as coronary artery disease, hypertension, and myocardial infarction. The next part of the case study presented by Ma'am Rochelle Alvarez. Take it away, ma'am.
Sir Devon, I'm sorry po. I think I would go next. I'll be talking about the objectives and the methods. So good evening, everyone. My name is Christina Alvarez, and I'm here to discuss about the objectives and the methods of our case report. So one of the first objective of our case report is to present a comprehensive clinical profile of a patient with chronic heart failure, including their medical history, presenting symptoms, and physical examination findings. Second, to describe the management and strategies employed for the patient's cardiac heart failure, including pharmacological interventions, surgical interventions only if applicable, and of course, our nursing care. We will also analyze the effectiveness of the management strategies implemented in improving the patient's symptoms, functional capacity, and overall quality of life, if there is return or partial return of quality of life. Next, to discuss the nursing implications and responsibilities in the care of patients with chronic heart failure, highlighting the role of nurses in assessing symptoms, administering medications, providing patient education, and promoting self care management. We will also explore the challenges faced in managing CHF and the importance of a multidisciplinary approach, emphasizing the collaboration between healthcare professionals involved in the patient's care. So this would involve not only the healthcare practitioner, but also the patient firstly, and then the nurses, the PT, OT, etc., or and also nutrition aspect of the care. Next, we will also evaluate the implications of the case study findings for nursing practice, education, and research, aiming to enhance the understanding of CHF management and improve patient care outcomes. We would also like to contribute to the existing body of knowledge on CHF, providing insights into the clinical presentation, management strategies, and nursing interventions specific to our patient case. And lastly, we would like to highlight the potential benefits of a holistic and patient-centered approach in the management of CHF, focusing on improving the patient's overall well-being and quality of life. And next, we would go with our methods. So we have six methods employed in our case report. So I'm sorry, sir, would you be able to share screen? So we would like to proceed. We have our methods. So this section outlines the procedures and methods used to gather data for the case study on congestive heart failure. The following methods were employed to collect relevant information and ensure the validity and reliability of the data. First, we did the most important is the patient interview. So this is a structured interview conducted with the patient to obtain a comprehensive nursing history. So we asked the patient's present medical history, the presenting symptoms, the past health history, family health history, family health history, and any notable changes in functional patterns. And next, we did review of medical records. So this is a thorough review of the patient's medical record um, to be able to make a sound diagnosis for the patient. And then we also looked into the previous treatments done with the patients, the laboratory and diagnostic test results, imaging studies, etc. We also made, of course, physical assessment. This is a systematic physical assessment was performed together. I'm sorry, sir, can you please go back to the previous slide? So a systematic physical assessment was performed to gather objective data related to patient's CHF condition. So in this physical assessment, we had the vital signs assessed, the heart and lung sounds, the examination of peripheral edema, and this physical assessment is important to support the diagnosis and management of the CHF. And lastly, fourth, we have the diagnostic and laboratory results, tests. One moment, Ma'am Jonaline and classmates. I would just like, ma'am, would you be able to go back to the previous slide, please, so they would be able to see the methods we use in our case report? Ma'am Marie? Uh, so I would just like to go through it again, Ma'am Jonaline. I will just be reading through them. I think there might be a connection problem with our um, colleague who presents the screen. So the fourth one is the diagnostic and laboratory tests. We will be showing this slide again. Um, we will be showing this slide again just so you could get a look at the methods that we've used. So the fourth is the diagnostic and laboratory tests. So these were also reviewed. This included the ECG reports, um, echocardiography reports, our cardiac enzyme levels, our blood chemistry profiles. All of these were essential to confirm the diagnosis, assess the severity of CHF, and also monitor the patient's response to the treatment. Fifth, we have consultation with our thank you, Mama Marie. Consultation with our healthcare professionals. So there was collaboration and consultation with healthcare professionals, not only not only the doctor, but of course we have the nurses, we have the experts. Um, so as mentioned earlier, this is a multidisciplinary approach. And lastly, we have the literature review. So this was a comprehensive review of relevant literature, research articles, clinical guidelines, and evidence-based resources. And this was done to ensure the case study was informed by current knowledge and best practices in the field of CHF management. We all know what was effective 5, 10 years ago may not be relevant or effective today, so it must be up to date. Thank you so much. And now I will be giving the floor to Miss Ma'am Rachel Ramirez. She will be talking about the nursing management. Thank you so much.
Hello everyone. My name is Rachel and I'm gonna discuss the nursing management. So the objective in managing CHF is to alleviate symptoms, slow disease progression, and improve the patient's overall well-being. This involves a comprehensive approach that integrates various disciplines, including lifestyle modification, medication therapy and potential invasive intervention like the cardiac resynchronization therapy or heart transplantation. Lifestyle changes may encompass dietary adjustments such as adopting a low sodium diet, regular physical activity, weight management, and smoking cessation, and adherence to prescribed medication. So nurses hold a critical role in the care of CHF patients, tasked with duties like monitoring vital signs, assessing symptoms, administering medication, educating patients, and promoting self-care. Um, they collaborate with other healthcare team member to develop personalized care plans, monitor fluid levels, and provide support to patients and their families in coping with challenges. CHF challenges. CHF is a complex and chronic condition requiring thorough management and ongoing assistance. So when patients with acute heart failure sought emergency care using a hospital-based strategy for clinical decision making and rapid follow-up resulted in a lower risk of death from any cause and hospitalization for cardiovascular reason within 30 days compared to usual. So congestive heart failure is a complicated and long-lasting condition that needs thorough management and ongoing help. Care professional must understand the causes, symptoms, and ways to treat CHF effectively to improve outcomes for patients. Next slide, please. So here are the clinical management for congestive heart failure. So the lifestyle adjustment, first is the dietary modification. So limiting sodium intake to mitigate fluid retention and regulate blood pressure. Emphasize well-rounded diet comprising fruits, vegetables, whole grains, and lean proteins. So we should restrict those people who have congestive heart failure for their sodium intake because it can cause fluid retention and fluid regulation. In certain instances, restricting fluid intake may be necessary to prevent fluid overload. And regular physical activity, encouraging exercise within the patient's capabilities to enhance cardiovascular health and overall fitness. And next is a smoking cessation, advising patient to quit smoking as it uh, exacerbates heart failure symptoms and heightens the risk of complications. Next is alcohol moderation. So advocating for moderation in alcohol consumption as excessive intake can weaken the heart muscles and exacerbate heart failure. Next is monitoring and follow-up. Regular assessment of symptoms, blood pressure, and fluid status. Adjusting medication dosages as needed based on changes in clinical condition and treatment response. Scheduled follow-up appointments with healthcare providers to evaluate disease progression, optimize therapeutic strategies, and address any inquiries or concern. Next is the pharmacological management. So the patient's medication regimen includes the following. First is diuretics, which is furosemide, prescribed to alleviate fluid overload and alleviate symptoms of congestion. Next is angiotensin converting enzymes inhibitor, which is the ACE inhibitor, lisinopril, administered to enhance cardiac function and listen after load. Next is beta blockers, which is the metoprolol, used to regulate heart rate, enhance ventricular function, and decrease myocardial oxygen demand. Next is the mineralocorticoid receptor antagonist, which is the spironolactone, further employed to reduce fluid retention and enhance outcomes in heart failure. And next is antibiotic, ceftriaxone, prescribed to address pneumonia-related infection. Um, Next who's gonna report is Mom Joanna.
For a while lang po, stop ko lang yung ano. Okay. Hold on. Ba't ganun? Wait lang po. For a while lang po. Screen ko pa din po ba or hindi na? Ganito ako. Hello ma'am, screen ko na po ba? Hello po.
Yes, ma'am.
Ayan po. Ayan. To continue with the report, so this is our case report. So the patient is 50-year-old male, present with acute complaint of progressive worsening shortness of breath, fatigue, cough, and bilateral foot swelling. So may edema din po siya. So the nursing history revealed a medical background of hypertension, obesity, and a family history of cardiovascular disease. So the patient reported difficulty performing daily activities and experiencing frequent episode of orthopnea and paroxysmal nocturnal dyspnea. So for the patient profile, we name it with his initial and admitted last March 5, 2024 at 9:30 in the morning. So here are the vital signs or initial vital signs we've taken. That 160 over 9, 160 over 110, which is our initial vital signs for the BP. Blood pressure of, pulse rate of 110, respiratory rate of 25, and the O2 sat of 87%. So Based on our physical assessment on this patient, we observed the patient is responsive, attentive, and conscious regarding to his environment and display. So the patient also has a BMI of 27.2, which is overweight. The chief complaint, to summarize, is a shortness of breath, fatigue, cough, and a bilateral foot swelling. Upon admitting diagnosis, it was diagnosed as congestive heart failure with hypertension. So the present medical history, or the day before being admitted, the patient reported feeling easy tired, having a dry cough, and experience a swelling on both um, lower extremities with grading scale of 1. 2 hours before admission, the patient suddenly felt of shortness of breath and discomfort in his chest. So upon consultation and assessment and conducted, so leading to admission on the same day, which is March 5, 2024. So based on the family history, the patient paternal grandfather had a history of hypertension and passed away from coronary artery disease at age of 55, while his paternal grandmother has ovarian cancer and died at 71. Similarly, the patient maternal grandfather had hypertension and type 2 DM, passing away at age of 68, while his maternal grandmother had unknown medical issues and died at age of 75. The patient father at age of 78 has history of hypertension also. And his mother also passed away from pneumonia and due to COVID-19 infection last 2020 at age of 76. The patient himself was diagnosed of hypertension 3 years ago. So for the social history, the patient maintained a positive connection with his family and friends and also to his neighbor. He engaged activities or he engages effectively with other, particularly with customers, since he has bakery shop. Common activity includes baking with his wife and playing chess with his friends. However, the patient has some unhealthy habits, such as smoking, typically consume 2 to 3 cigarettes daily, as claimed, with occasional alcohol consumption as well. So to discuss uh, with one of the nursing care plan, may I call Miss Christian? Hello, ma'am.
Yes, ma'am. Ano ko lang yung sa slide po. No. For our nursing care plan, we have the number one NCP, we have the subjective data para sa assessment namin. Nahihirapan akong huminga as verbalized by the patient. Tapos, objective data, use of accessory muscle in breathing, restlessness, positive nasal flaring, positive coarse crackles, diaphoresis, respiratory rate of 25 cycles per minute. And we also have the O2 sat of 94%. As a diagnosis, impaired gas exchange related to imbalance between oxygen supply and demand, secondary to fluid buildup in lungs, or pulmonary edema as evidenced by use of accessory muscles in breathing, nasal flaring, coarse crackles, diaphoresis, RR of 25, and O2 sat of 94%. For our planning, we have the short term. After 30 minutes to 1 hour of rendering nursing intervention, the patient will display improvement in ventilation as evidenced by oxygen level of 95% and above and RR within 12 to 20 cycles per minute. For the long-term planning, after 3 to 4 hours of rendering nursing interventions, the patient will demonstrate adequate oxygenation as evidenced by absence of respiratory distress, nasal flaring, and diaphoresis. For the intervention, we have the independent and the dependent interventions. For the independent, we have to monitor the vital signs, elevate the head
One
of the bed,
question.
encourage relaxation. Yes,
One
ma'am.
question, excuse me po. I think there is no need for you to actually discuss each part of the nursing care plan. So siguro you just give us a summary of ano to, or describe why you were able to arrive at this diagnosis for your patient, and then what did you do in terms of interventions or nursing management, and then how did the patient respond to the interventions that you provided.
Yes, ma'am. So for our
Ganun na lang po para mas
first,
mabilis yung presentation natin, Ma'am Christian.
yes, ma'am. So for our first signs and symptoms of the patient as dyspnea, ang ginawa po ang management or intervention po sa kanya is to encourage relaxation techniques and administer medication as prescribed by the physician, also with the oxygen support. So, ang naging evaluation po sa patient is after rendering nursing intervention, the patient displayed improvement in ventilation and as evidenced by absence of respiratory distress, nasal flaring, and diaphoresis. So, the patient is being relieved from dyspnea. So, dun po sa number 2 na assessment, bigla akong nanghina as verbalized by the patient. So, we have the objective assessment with data or the shortness of breath. We also have the jugular vein distension, bipedal edema. So as our intervention, we place the patient in semi-Fowler's position, elevated lower extremities, encourage relaxation techniques, administered oxygen, and administration of digoxin as prescribed by the physician. So after 4 hours of nursing interventions, the patient was able to demonstrate activities to increase cardiac output, manifest normal vital signs. So, yun po yung naging evaluation. For the third assessment, madali akong mapagod at hindi ako makahinga ng maayos kapag gumagalaw-galaw ako at may ginawa as verbalized by the patient. So, as the independent intervention, we plan balance activities and rest periods, assisted patient in activities and promote safety. Still, we encourage proper deep breathing technique and administer medications as prescribed by the physicians. So after 8 hours of rendering nursing interventions, the patient demonstrated relief from shortness of breath. The patient already has a 19 RR, BP of 110/70, and negative nasal flaring. So for the fourth NCP, may we call Sir Devon Ray Leongson? Sir Devon for the fourth assessment. May we have Sir Jonel instead?
Ma'am, sorry, hindi. Yes, sir. Proceed, sir. Ako na lang po sa 5th NCP. Thank you.
Sir, naka-mute ka po, Sir Jonel.
Yes, sir.
Hello?
Who's supposed to present next po? Kasi baka nakamute sila or what? Or another group member can take over po siguro. Baka they're having difficulty.
Yes, ma'am. Yes, sir. Audible ka, sir.
Nagsasalita po ba si Sir Jonel? Kasi I cannot hear anything.
Yes, ma'am. Naririnig naman si President. Yes,
Wala
sir.
din po sa end ko.
Wala po, ma'am.
Sir Gionel, audible ka po.
Audible ka din,
Yes,
sir.
Sorry, hindi po siya naririnig.
Wala din po sa end ko.
Pero naririnig namin siya, ma'am.
Pinipili lang ata ni Sir Jonel yung ayaw niya. Some of you can hear him, pero I cannot hear.
Okay. On the fifth assessment, napansin ko na lang na biglang gumigat ang paa ko at hindi ko magkasya ang tsinelas ko. The objective assessment, we have crackles on both lung field, pitting edema grade 1 extremities at the lower extremities and jugular vein distension. Weight is 85 kilograms. BMI 27.7. It is overweight. So the planning is after 3 days of nursing intervention, the patient will display no presence of edema in lower extremities. So nursing intervention, of course, monitor vital signs, maintain on semi-Fowler's position, and elevate both legs to increase venous return to somehow decrease edema on the lower extremities. Of course, monitor INO. We need to limit sodium intake and fluid intake of the patient. Then promote the use of compression stockings. And then after 3 days of nursing intervention, there is decrease in the edema of the patient. Next slide. Then we have the fifth assessment, subjective data. Hirap akong huminga as verbalized by the patient. Objective data, we have the edema in the lower extremities, persistent cough, autosat of 87%, that's 87%, RR of 25, and pulse rate of 110. So our planning is that we have the short-term plan. We have within 30 minutes of rendering nursing intervention, patient will manifest pulse within normal limits and verbalize decrease in chest pain. Sorry, at the objective assessment, chest pain is included. We forgot to include. So our intervention position the patient in moderate high backrest. The rationale of positioning the patient to that position is to facilitate maximum lung expansion. Of course, limit sodium and fluid intake to avoid fluid overload. Provide periods with calm environment to relieve undue fatigue. And then dependent intervention, of course, administer oxygen as ordered by the physician. administer medications as ordered, like diuretics. So, at the end of the intervention of with the interventions given to the patient, the short-term uh, goal are met. Patient manifested pulse rate of 90 and verbalized decreased chest pain. And the long term, it is goal met. Patient manifested decrease in edema in lower extremities. Sir Joyanel, continue the sixth assessment, please. Thank you.
Yes, sir.
Yes, sir.
Still no audio po sa part ko. Thank you.
Yeah, same. Same, Sir Jonel. Wala pa rin pong audio. Baka pwedeng the other group members can take over meantime habang inaayos ni Sir Jonel yung ano niya. Baka dapat mag-exit ka muna, Sir, tas rejoin na lang the meeting.
Ma'am Christian, please continue the sixth assessment, please.
So we have the sixth assessment, the subjective data. May oras na hirap kong igalaw ang aking mga binti as verbalized by the patient. The potassium level, we have 3.3. Positive numbness and tingling sensation on legs, positive leg cramps, and episode of leg weakness. So for our short-term planning, after 1 hour of nursing intervention, patient will be able to verbalize understanding of nutritional status and ways to maintain normal electrolyte levels. So, as our intervention, we have to monitor intake and output, educate patient and family members on the importance of potassium-rich foods to include in their diet, and then administer prescribed medications as ordered by the physician. So, for our short term, goal met after 1 hour of nursing intervention, patient was able to verbalize understanding of nutritional status and ways to maintain normal electrolyte levels. So that's all for our nursing care plan. Then we have the ethical consideration by Sir Jonel.
Dito, ang washing. Ang ref. Kapag
Yes,
sila
sir.
Dili. Pag mag-trip siya, kasi trip ka.
Hindi siya naririnig sa part ko, ma'am.
Oo, sir.
Sir, naririnig kita. Yes, sir.
Okay naman, sir.
Ma'am Jonaline, I'm sorry po. Do you hear Sir Jonel na po ba?
Hindi pa rin lang.
Kasi po, meron pong audio sa iba. Would it be okay po with the members of the group na ako na lang babasa ng ethical consideration and conclusion po? Would that be okay, ma'am and group mates?
Sige po, ma'am. Go.
Okay po,
Yes,
okay
ma'am.
po, ma'am.
Okay, thank you so much. So with our ethical consideration, Ma'am Jonaline and classmates, so in this case study, I'm sorry, my audio is, sorry. Okay, so in this case study, we ensure that the patient and the authorized representative fully understands the proposed treatment. So we actually have a consent signed by the patient. Also, there is also a clause there stating na pwede po siyang mag-withdraw ng kanyang consent after giving it, just in case hindi po siya comfortable with any of the procedures or treatments being given or done to him. So In those, we have the proposed treatment, the potential risks, and alternatives before consenting to any interventions. So the patient's right had been implemented to participate in decision making regarding the care and taking into account his values, preferences, and goals. So we also maintain the patient's privacy, especially his health information, and only disclosing it to those involved in their care. So pag hindi po kasali, hindi po mag-disclose yung consent. Sorry, yung mga details po. Next, ma'am, please, next slide. So lastly is the conclusion. So this case report illustrates the comprehensive care provided to a patient with congestive heart failure, emphasizing the importance of a multidisciplinary approach involving pharmacological management and nursing interventions. So by addressing the patient's specific nursing problems and promoting self-care strategies, the aim was to improve symptoms, enhance functional capacity, and optimize the patient's overall well-being. So the findings from this case contribute to the existing body of knowledge in CHF management and highlight the significance of collaborative and patient-centered care in achieving positive outcomes. So we've also included some of our literature matrix, just in case anyone would like to go or read into this case report. And we also have included our reference, Ma'am Jonaline and classmates, on the last slide. Thank you very much, and that will be all for our case report.